If you're past 60 but still approach self-pleasure the same way you did at 30, you may be quietly damaging your circulation, your prostate, and even your nerve function. I'm Dr. Mason Hartley, a board-certified urologist with 25 years of experience in men's health. Over the decades, I've treated thousands of men who never realized that their techniques needed to evolve as their bodies aged. Today, I want to break the silence and show you exactly how to practice safe, healthy self-stimulation after 60. We'll uncover 3 common mistakes that can cause harm, the medical red flags that should never be ignored, and finally, a step-by-step method you can safely use. Let's start with the truth. Self-pleasure does not suddenly become unhealthy after 60. In fact, gentle, regular stimulation helps support prostate health, keeps blood flowing, and preserves sexual function. But here's the key: you cannot keep doing it the way you did in your 30s. Your body has changed, and your approach must change with it. After 60, several biological systems that govern sexual response shift dramatically. Testosterone, the hormone that drives libido and performance, has been quietly declining, about 1 to 2% per year since age 30, and the drop accelerates after 60. The blood vessels that feed the penis stiffen as collagen and elastin weaken, making erections slower to appear and harder to sustain. Nerve endings lose sensitivity, a process neurologists call age-related sensory decline. And the speed of nerve signaling slows, which means the message from your brain to your body takes longer to arrive. Most striking of all, recovery time expands. The refractory period, the downtime between climaxes, can stretch from minutes in your 20s to days in your 60s and beyond. If you don't adapt to these changes, you risk doing real damage. I've seen men develop chronic nerve irritation, prostate inflammation, and circulation problems simply because they never adjusted. That's why I'll guide you through the 3 most dangerous mistakes older men make when masturbating, then share a clear protocol with safe positions, recommended products, and practical adjustments. And before we finish, I'll highlight the red flag symptoms that mean it's time to call your doctor, and how to start that difficult but necessary conversation. This isn't just about pleasure. It's about protecting your long-term health, preserving intimacy with your partner, and making sure you never face complications that could have been prevented. The first, and most damaging, mistake men over 60 make is using too much force and grip. As sensitivity naturally declines with age, many men instinctively squeeze harder, believing this will bring back the intensity they once felt. But medically, that's the exact opposite of what should be done, and it can cause permanent harm. Here's why. Inside the penis are delicate chambers called the corpus cavernosum, sponge-like tissue that fills with blood during arousal. Surrounding these chambers are tiny blood vessels and sensitive nerve pathways. When you apply excessive pressure during self-stimulation, you compress these fragile structures. Over time, this repeated strain can lead to pressure-induced neuropathy, nerve damage caused by years, or even decades, of overgripping. I've seen men who developed permanent numbness in certain areas of their penis because of this habit. Others damaged the very blood vessels that support erections, leaving them with poor circulation and increasing difficulty maintaining firmness, even with a partner. What begins as a small adjustment to feel more can spiral into a destructive cycle: less sensitivity, tighter grip, more nerve damage, even less sensitivity. One patient once admitted he could only climax by squeezing so hard that it would be painful for any partner. That's not just a preference, that's a clear sign of nerve injury from years of overgripping. The solution? Something I call pressure titration. Start with the lightest possible touch that still creates any sensation. If you don't feel much right away, the answer is not to grip harder, it's to give your nervous system more time to respond. Allow 60 to 90 seconds for those nerve pathways to wake up, and only then gradually increase pressure. But never tighten so much that you compress the shaft completely. Think of it as a gentle massage, not a mechanical squeeze. Backhand index pointing right. If you found this valuable, make sure you subscribe to Wise Elders Tales. In my next video, I'll reveal the 3 hidden killers of erectile function that have nothing to do with testosterone, and you absolutely don't want to miss that. Mistake number 2, overdoing it, masturbating too often for your body's age and recovery capacity. Many men in their 60s try to keep the same pace they had at 30, sometimes daily, or even multiple times a day, without realizing that the physiology of an older body can't keep up with that demand. What once was harmless can now tip the balance toward harm. From a medical standpoint, here's why. The prostate gland produces nearly 30% of semen. It's filled with specialized enzymes and proteins that play a vital role in sexual health. But after 60, the prostate simply takes longer to replenish these secretions. If you push it too often, you are essentially overworking the gland, which can lead to irritation, inflammation, and in some cases, contribute to benign prostate enlargement. There's also a hormonal rhythm that shifts dramatically with age. Frequent ejaculation can interfere with your body's natural testosterone cycles. That disruption may leave you feeling fatigued, irritable, and with a lower sex drive than before. In the long run, even hormones like LH, luteinizing hormone, and FSH, follicle-stimulating hormone, key players in reproductive health, become more sensitive to these disturbances. In my practice, I've seen men develop what I call ejaculatory fatigue syndrome. Instead of leaving them satisfied, each climax left them feeling drained, less fulfilled, and progressively harder to achieve. The joy of release turned into a sense of depletion. The solution isn't abstinence, it's pacing. Based on decades of clinical observation, the sweet spot for most men after 60 is every 48 to 72 hours. That rhythm allows the prostate to recover, hormone levels to reset, and the nervous system to restore its sensitivity. For some, even twice a week brings stronger, more satisfying orgasms, better energy, and a more stable mood. The lesson here is simple. After 60, quality matters more than quantity. By slowing down, you often gain more than you lose. Mistake number 3, masturbating without lubrication. Many men assume that lubricants are only necessary during partnered sex. Medically speaking, that's simply not true, especially after age 60. As testosterone declines, the body produces far less natural pre-ejaculate, the fluid that once provided a little natural moisture. For some men, it disappears almost entirely. At the same time, penile skin becomes thinner, more fragile, and far more vulnerable to microinjury. When you masturbate dry, the friction can cause microscopic tears in the skin. These tears may be invisible to the eye, but they're large enough to allow bacteria to enter, leading to infections, inflammation, or painful balanitis. In my practice, I've seen older men who suffered recurring infections simply because they never used lubrication. Some even developed chronic inflammation that made every form of sexual activity uncomfortable. And here's what's even more concerning: repeated dry friction can cause scarring. Over years, scar tissue may form around the head of the penis, permanently dulling sensitivity. I've treated men who developed hardened, less responsive skin as a result of decades of dry masturbation. The medical solution is crystal clear. Always use a high-quality, unscented, water-based lubricant before any self-stimulation. Apply it at the beginning, not as an afterthought when friction already becomes uncomfortable. Avoid products with glycols, parabens, or artificial fragrances, as aging skin is much more prone to irritation. And if you're using condoms with a partner, avoid oil-based lubricants, since they can degrade latex. Some reliable, widely available options I often recommend include Good Clean Love, ALOC Cadabra, or simple pharmacy staples like KY Naturals. A small investment in the right lubricant can save you from very real medical problems down the road and keep your experiences both safe and enjoyable. Now, let me share with you what I call the CARE method, a complete, science-backed approach for safe, enjoyable, and restorative masturbation after age 60. This framework is designed not only to protect your sexual health, but also to help you maintain intimacy with your own body in a way that supports circulation, prostate health, and long-term nerve function. C. Cleanliness and comfort. The very first step is one most men overlook. Before you even think about beginning, wash your hands thoroughly. This isn't just about avoiding infection, it's about giving your nervous system a cue that you're safe, prepared, and in control. Our brains are wired to relax when we take small rituals seriously, and relaxation is essential for both arousal and satisfaction. Next, consider your environment. Choose a private, quiet, and comfortable space. Many older men underestimate how much physical comfort affects arousal. Sitting on a hard chair, for example, can compress nerves in the pelvic area and actually interfere with blood flow. Instead, try lying back in bed with a pillow behind your shoulders or resting on your side if that feels more natural. The goal is to create an environment where tension is minimized and your nervous system can fully engage. Think of this stage as preparation, not a distraction. Just as athletes warm up before exercise, your body benefits from setting the right conditions before stimulation. When you prioritize comfort, you reduce the risk of nerve compression and signal to your body that it's okay to let go. The appropriate technique. Technique is where most men run into problems after 60. The rules you followed at 30 no longer serve you today. Here's the golden principle: less force, more awareness. Always begin by applying a water-based, unscented lubricant before you start. This is non-negotiable at this age. As we discussed earlier, dry friction causes microtears, infections, and in the long term, permanent loss of sensitivity. Think of lubrication as the foundation of safe practice. Start with a very light grip and slow, deliberate movements. Use your whole hand rather than just your fingers so that pressure is distributed evenly across the shaft. Allow arousal to build gradually rather than trying to force a quick result. If you notice your grip tightening unconsciously, stop, take a breath, and reset. Your goal isn't speed, it's quality of sensation. Vary your hand position every few minutes. For example, if you normally stroke in a single rhythm, occasionally change the angle of your hand, switch hands, or explore using different parts of your palm. This prevents repetitive stress on one nerve cluster and helps wake up sensory areas that may have become less responsive over the years. Some men also find that using a male sleeve or a textured device provides stimulating variety without requiring a crushing grip. These tools are designed to add sensation safely, giving you intensity without injury. Think of them as training aids, helping you rediscover pleasure without strain. Respect timing and recovery. This is where older men can transform their experience. In youth, climax often came quickly, and that was fine. But after 60, rushing only works against you. Instead, give yourself at least 15 to 20 minutes for the entire session. Allow arousal to rise, fall, and rise again in waves. This wave-like pattern is completely natural and often leads to more intense and deeply satisfying orgasms compared to forcing a straight line to climax. If you feel yourself getting close too quickly, slow down, change your rhythm, or pause altogether. Learning to enjoy the build-up is as important as the release itself. And just as vital, honor your body's recovery needs. The prostate, the nerves, and your hormone cycles all require more downtime than they did in your youth. For most men after 60, spacing sessions every 48 to 72 hours is the sweet spot. This rhythm gives your prostate time to replenish fluids, your hormones time to reset, and your nervous system a chance to recharge. In fact, many of my patients report that by reducing frequency, their orgasms actually became stronger, their energy improved, and their mood lifted. Remember, at this stage of life, quality matters more than quantity. Evaluate constantly. The final step in the CARE method is mindfulness. Pay close attention to what your body is telling you, not just during, but after the session. If you experience unusual pain, persistent numbness, changes in sensitivity, or a burning sensation, these are warning signs. Don't dismiss them as just aging. Many issues, from prostate inflammation to nerve irritation, can be treated if caught early. Ignoring them only makes matters worse. Think of this as a feedback loop. Every session is an opportunity to check in with your body. Do you feel energized afterward or depleted? Do you notice improved mood or lingering discomfort? These subtle signals help guide your frequency, technique, and recovery time. Self-pleasure at this stage of life should leave you feeling restored, not drained. If you consistently feel the opposite, it's time to adjust your approach or speak with a healthcare professional for further evaluation. Bringing it all together. The CARE method isn't about restriction, it's about liberation. By making small but intentional adjustments, you can transform masturbation from a habit that causes harm into a practice that supports your long-term health. Cleanliness and comfort create the right setting. Appropriate technique protects nerves and circulation. Respecting timing and recovery ensures that your prostate and hormones remain balanced. And ongoing evaluation keeps you tuned into what your body really needs. After 60, self-pleasure can remain a source of vitality, intimacy, and joy if you practice it wisely. By treating your body with the same care you would give any other important system, your heart, your brain, your lungs, you preserve not only your sexual health, but also your confidence and independence. Remember, this is not about clinging to the past, but about embracing a new way forward. With the CARE method, pleasure becomes sustainable, safe, and deeply satisfying, something that enriches your later years instead of taking away from them. Here are the warning signs that mean you should see a urologist right away. Persistent pain that lasts longer than 30 minutes during or after masturbation. Pay special attention if the pain feels sharp, burning, or grows worse over time. Discomfort that doesn't fade is your body's way of signaling that something isn't right. Sudden changes in sensation. If you notice new numbness, tingling, or burning that lingers for hours, this may indicate nerve compression or even nerve injury. Don't assume it will simply go away. Early evaluation can prevent long-term damage. Visible changes on the surface. Swelling, discoloration, unusual lumps, or any type of discharge that continues for more than 24 hours should be taken seriously. If the discharge is yellow, green, or has an unusual odor, infection is a likely concern. Urinary symptoms. Difficulty starting or stopping your stream, burning during urination, frequent urges, or dribbling after you finish can all be signs of prostate inflammation, urethral irritation, or infection, conditions that require medical care. Any bleeding, even a small amount. Blood can signal skin tears, inflammation, or in some cases, more serious issues. Never ignore it. Erectile changes. If you suddenly find it difficult to achieve or maintain an erection during masturbation, when this wasn't a problem before, it could point to circulation or nerve problems that deserve medical attention. The bottom line, do not hesitate to contact your urologist. Nothing you describe will surprise us, we've seen it all before. And in nearly every case, early treatment prevents a minor problem from becoming a major one. Taking action quickly protects not only your sexual health, but your overall well-being. As you've seen today, staying sexually healthy after 60 isn't about giving up, it's about adapting. The body changes with age, but that doesn't mean pleasure has to fade or that intimacy with yourself has to disappear. By avoiding the 3 common mistakes we discussed, practicing the CARE method, and paying attention to the warning signs, you can protect not only your sexual health, but also your circulation, your prostate, and your nervous system. Remember, healthy self-pleasure at this stage of life should leave you feeling restored, not drained. It should enhance your confidence, improve your mood, and remind you that your body is still capable of joy and connection. These small adjustments, lighter pressure, slower pace, proper lubrication, and respecting recovery, may seem simple, but together they can transform your experience and prevent years of unnecessary problems. And here's the most important point, you don't have to go through this alone. If something feels off, if you're noticing pain, numbness, or changes that concern you, don't wait. Talk to your doctor. The earlier you act, the easier it is to correct. This channel, Vital Health Seniors, is here to give you the knowledge your body deserves and the guidance most doctors rarely talk about openly. If you found this video valuable, I encourage you to stay connected with our community. Hit that subscribe button so you never miss an episode. Tap the thumbs up because it helps this information reach more people who need it. And don't forget to click the notification bell so you'll be the first to know when new videos are released. Your health, your confidence, and your vitality are worth it. Let's continue this journey together, stronger, wiser, and healthier every step of the way.